Welcome to War Docs, the military medicine podcast. This show brings you a firsthand, behind-the-scenes look into the mission, unique opportunities, and deployed experiences of the entire military healthcare team. From state-of-the-art hospitals in the United States to the most austere environments across the globe, War Docs has you covered.
Today's guest on War Docs is Navy Captain Retired Ed Norton, Chief of our DHA's Pharmacy Operations Division. I'm your host, Major General Retired Jeff Clark. Ed, welcome to War Docs.
Oh, thank you, sir. Glad to be here.
Yeah, good. So, Ed, let's begin by having you share with us a little bit about your background, your service in our Navy, and how you came to serve in DHA's Pharmacy Operations Division.
So I retired in 2019 from a 30-year career in the Navy. I was a pharmacist most of that time. Started off, I was a line officer for a short period of time, but then I switched over to being a medical service corps officer. The last 5 years of my Navy career, I was at the Defense Health Agency. Most of that time, I was the Deputy Chief of Pharmacy Operations Division. And before I came over to DHA, I actually was the Navy Pharmacy Service Consultant and had some input on the initial stand-up of how the DHA pharmacy operation was going to be structured.
Yeah, thank you for that. So now you're the chief, and so could you tell us a little bit about what that means and what your roles and responsibilities are?
Oh, certainly, yeah. So as the Chief of Pharmacy Operations, I have a team of about 100 people altogether, probably 15 military officers, a couple enlisted service members, maybe 40 civilians, and then the rest would be contractors. And so what we do is we essentially manage and administer the TRICARE Pharmacy Benefit.
So you mentioned that, prior to joining DHA, you were the Navy's service rep to the pharmacy operations. And so I understand that approach continues. And so each of the services have a senior pharmacy representative, and y'all gather on a regular basis, sort of like a board, to talk about how things are going way ahead. Does that sound about right?
That's correct. Yes, sir. So each service has what I refer to as a service pharmacy consultant, which is similar to the role I was in, I guess now about 14 years ago. And I meet with them weekly, and then they also serve on our DoD P&T committee.
Excellent. Also understand that you do regular meetings with the MTFs and their pharmacy reps to help everybody stay informed. Can you tell us a little bit about that?
Oh, yes, sir. So I have a quarterly webinar with all of the pharmacy personnel who choose to dial in out at the MTFs. So quarterly, I kind of share what's going on here at headquarters. We highlight some best practices that are happening at a specific MTF. I have some of my staff that will maybe go into the weeds on what's happening with changes to TRICARE formulary, changes as a result of legislative action. And then also on a more shorter time frame basis, my DHA pharmacy consultants, of which I have about 10 of them, they have assigned MTFs, and they probably are talking to the pharmacists out in the field probably a couple times a week at each MTF.
Yeah, that's excellent. The way you have a very sort of a flat organization to provide, to gather input and to keep people informed and to see what's going on. That's really very impressive, and as it should be at any time that we're coming together to operate something as big as the pharmacy benefit. So, can you tell us a little bit about that? How many individuals you serve? Kind of what's your budget, et cetera, how many prescriptions you fill?
TRICARE Pharmacy Benefit is pretty expansive. We serve, all the DoD eligible beneficiaries, of which is about 9.6 million of them who could use the pharmacy benefit. We find a little over 7 million of them use the pharmacy benefit regularly. And then we fill across all 3 points of service, so the military treatment facilities, the TRICARE mail order pharmacy, and the retail network pharmacies. We fill about 180 million 30-day equivalent prescriptions per year. And I use 30-day equivalent prescriptions because a mail order will give a 3-month supply and retail will give a 1-month supply. If you're looking at total count of prescriptions, it's about 115 million prescriptions a year. And then the spend for all those prescriptions is around $9 the net cost of the government is around $9 billion a year.
About $9 billion a year. And I guess that's $9 billion of the 50-some billion total DHP. Is that right?
Yes, sir. I mean, I think the unified medical program is in the $50 to $60 billion range, and then so pharmacy is a pretty sizable piece of medical, and then of course medical is a pretty sizable piece of the overall DoD budget.
Yeah, it is. Medical's about 7.2% of the DoD budget, and then your portion is it sounds like 15 to 20% of.
Yes, sir. That's about what it would be.
Okay, thank you for that. So let's talk about the operational force before we get into more specifics of the benefit. How does the pharmacy benefit your team support the operational force?
Well, so we actually support the operational forces in several different ways. So I think the most straightforward way is the pharmacy staff out at the MTFs fill prescriptions for the operational forces. Make sure that they're medical ready when they're in garrison and provide them with medication when they're going to deploy. We also, through our Express Scripts contractor, have the deployed prescription program, which allows deployed service members to receive medication through mail order to the base or FOB that they're located at. And then I think as far as maintaining a ready medical force, by working at our MTFs, the pharmacists and pharmacy technicians of the services are able to maintain their pharmacy skills, and they're basically ready to go downrange and perform their operational mission.
Thank you for that. So formulary management. Tell us a little bit about formulary management for the TRICARE Pharmacy program.
Okay, certainly. So formulary is a fancy word for essentially a list of medications. The formulary for the TRICARE Pharmacy Benefit is quite expansive. It probably covers, I would say 15 to 20,000 drugs, although some of those might be used very sparingly because they're no longer current therapies. But there's a large list of drugs, and so we have a DoD P&T committee that basically manages that TRICARE formulary during their quarterly meetings. So they review the new drugs that have came to market and sort of review those drugs and determine on what formulary placement they're going to have, if they're going to be a formulary product or a non-formulary product or a completely excluded product. Then generally there'll be 2 or 3 classes of medications that will be reviewed by the P&T committee every quarterly meeting. And so generally the class, we're looking at the drugs that provide, that are the safest, the most effective, and provide the best value to the government.
Yeah. Would you say classes of drugs, or is that like for hypertension or diabetes or?
Right. And sometimes like when you have a disease state, there may be a couple of different classes. If you say with hypertension, there might be like the diuretics would be a class, the calcium channel blockers, the beta blockers, ACE inhibitors, things like that would be a class within a disease state.
I've heard about pharmacy benefit managers, PBMs, in the news and on TV and so forth. We have a DoD has a pharmacy benefit manager. Could you talk more about that? What the roles are?
Oh, certainly. So yeah, you are correct. The pharmacy benefit managers are making the news. They're often referred to as middlemen. We do have a contract with a pharmacy benefit manager ourselves, specifically Express Scripts. And they provide quite a bit of support for the TRICARE Pharmacy Benefit. We have quite a different relationship with our PBM than the commercial insurance companies do, where we have the contract and the PBM essentially executes the government's requirements. The main things that they'll do for us is they will basically ensure claim processing for the military treatment facilities, and essentially claim processing means double checking eligibility, making sure that the drug is on formulary, making sure that there's no interactions with other drugs the patient has already taken. And then they also provide the TRICARE mail order pharmacy benefit. So Express Scripts is essentially filling those prescriptions and mailing them to the beneficiaries. And then in our retail point of service, they establish the network of the pharmacies that are going to partner with the government and with TRICARE and fill prescriptions on behalf of our patients and bill seamlessly, so the patients just come in, pay their copay, and leave with their prescription. So the Express Scripts essentially establishes and manages that network for us.
And I think you previously mentioned that Express Scripts also does mail order directly to a deployed service member. Did I
That's
understand?
correct. Yes, sir. Yeah.
Yeah, sounds like our PBM Express Scripts is an integral part and is more of a direct contract and a part of the team that provides the benefit than the traditional PBM. It sounds like.
That's correct. I think a big difference between us and civilian pharmacy plans is with the civilian plans, the PBM is kind of giving a wide discretion on how they manage the pharmacy benefit on behalf of their customer. In the case of DoD, we have very specific requirements in the contract. So the PBM is doing the work that the government has determined for them to do. So, the size of the network, various performance standards for the network, is like say access, number of people that have within a 15-minute drive time of a pharmacy. All those requirements are set out by the government, and basically Express Scripts meets those requirements. And should they not, we have tools within the contract to reward and punish if they don't meet our needs.
Yeah, thank you for that. That's very helpful. I don't think most folks don't appreciate that, and I think that's good for all of us to know that take advantage of what the military health system provides.
Right. Yes, sir. I mean, the PBM is definitely a partner of ours. When you figure 2/3 of the prescriptions our beneficiaries receive are filled at either mail order or retail network, we wouldn't have the benefit we have if it wasn't for the PBM.
Right. Yeah. So thanks for explaining what Express Scripts does for us. What do you see as the top challenges facing you and your team and the TRICARE benefit? Some other challenges, opportunities. Could you talk a little bit about that?
Oh, certainly. I think what I see as a challenge, which is also an opportunity, is the challenge is as the pharmacy benefit continues to become ever more expensive. There's new drugs that come to the market. There is also more of a movement away from the MTF. So there's been some changing with staffing levels and the capability the MTFs have. And I think what we see as the opportunity is, we want patients to be able to come to the points of service that provides the best value to them. So that would be the military treatment facilities where they don't have any copay at all. And it would be the TRICARE mail order pharmacy where they get a 3-month supply for a copay that's actually less than a 1-month supply at a retail pharmacy for most drugs. And so not only do the patients, have the convenience of mail order when they use the TRICARE mail order pharmacy, or the advantage of no copay when they go to the military treatment facility. It's also a situation where the government and the taxpayer pays a lower cost for these drugs. So it's a good deal for the taxpayer and it's a good deal for the patient to use mail order or the military treatment facility.
Yeah, thanks for explaining that. I think, again, many folks don't appreciate what mail order provides. It's cheaper for the government, but most importantly, perhaps, is often cheaper for the individual who's taking advantage of that, as you described. So,
it is, yeah, yes, sir. Especially for brand name medications, where I think the copay at the retail network is like $39, it's $37 or so at mail order, and you get 3 times as much generally. So it's less than 1/3 the cost, and that's for the patient. And then to the government gets a greater cost savings when we're purchasing the drugs through the the Defense Logistics Agency than if we're using it through the commercial market.
Yeah. You've talked a little bit about that, but what initiatives are you and your team implementing to address some of these challenges or opportunities?
Right. Yeah. So I think a lot of it is communication. We want patients, not only just patients, but also even the military treatment facility staff, to know that when if they're not able to meet a patient's needs or the MTF is not convenient for a patient, that the military treatment facility staff are telling the patient, mail order is the place you want to go. It's convenient and it's less expensive for you. At the MTFs, we're implementing the use of technology to try to make for a better patient experience, a more streamlined experience. A lot of that ties in with the new electronic health record, Genesis. So Genesis definitely changed the workflow in a lot of our facilities. And, we now have ways where patients can use like Q Anywhere, which is a way of telling the pharmacy, hey, I want to get my prescription filled and I'm on my way and I want to pick it up tomorrow. And in that way, the pharmacy can pre-fill this prescription and it results in less time at the waiting area when the patient arrives. And then also allows the pharmacy staff to ensure that they're dedicating their time to patients that will be coming up to the pharmacy right away, as opposed to maybe next week or maybe never. So it works well for managing the workflow. And so I think a lot of it is just using technology to make a better experience at the MTF, and then also informing patients of, come on back to the MTF. It's changed. It's better than it was. We have a lot of tools to make things more convenient. And if the MTF isn't the choice for you, we want to inform patients about the advantages of mail order.
Thank you for that, and I appreciate you're proactively meeting patients where they are and giving them options so that they can choose how they want to get their prescriptions filled and take advantage of that. And so I appreciate that, and thanks for what y'all do. I guess as we wrap up, it's off topic just a little bit, but so if there was you were chatting with a young person who was considering joining military medicine to be in the pharmacy or not, what would you share with them about serving in military medicine?
Well, I think military medicine is a great practice environment. As for myself, I spent 30 years in the Navy. As I jokingly say, I stayed till they kicked me out. And then I came back. I was a contractor supporting the Defense Health Agency, and then later, accepted a civilian position. So I'm now looking at like 35 years of working in military medicine. And, I think it's a case that, we take care of, America's patriots, the active duty forces, the dependents of these active duty, our retirees. Definitely a higher calling, the kind of a purpose that we serve in the defense of the nation. And I think just the camaraderie and kind of the sense of teamwork that we have in military medicine just can't be matched in a civilian environment.
Same way. I hung around until they told me I had to. Couldn't hang around anymore because I loved it just as much as you do.
Yes,
Thank you again for that. So, folks, our War Docs guest has been Navy Captain Retired Ed Norton, Chief of Pharmacy Operations for our Defense Health Agency. Ed, I thank you for being a guest on War Docs. I thank you for your service. I thank you for what your team do every day for our military health system and our nation.
Oh, thank you, sir. I'm glad to be here, and thank you for inviting me.
Indeed. Ed, thank you. May God bless.
Thanks.
Thank you for listening to War Docs. We sure hope you enjoyed it. War Docs is a nonprofit organization supported by donations from listeners like you. Please follow and subscribe to our show on whatever platform you consume your podcasts, and rate and review this episode, and share the show with your contacts on social media. Find out more information about our show, our guests, and how to become a member of Team War Docs on wardocspodcast.com. Thank you for your support. If you like war stories and medical drama, War Docs has you covered. Spread the word.